Good evening and welcome to testing your blood glucose with a True2Go monitor. Before we get started, I just want to review with you the fact that more than 25 million Americans have diabetes. There are two types of diabetes. There's type 1, where the body just does not produce insulin, which is used to pull sugar into the cells. Then the most common type is type 2 diabetes. Most of the Americans that have diabetes have type 2 diabetes. With type 2 diabetes, the body does not create enough insulin, or the cells don't recognize the insulin so that it may utilize it to pull sugar into the cells. With either type of diabetes, you will have to check your blood sugar. Well, in checking your blood sugar or blood glucose, you need a meter to check your blood sugars. Well, I have purchased the True2Go. It is very small, very convenient, and very easy to take with you when you travel. With any meter, you want to always first read the manufacturer's manual. It is very important, if you're going to use any meter, that you thoroughly read the instructions for utilizing it. So with my meter, it is very, very easy to use. Several things will come with your meter. You will have lancets, which you will need to prick your finger. But remember, some meters don't come with them and you have to purchase them separately. You will also get test strips. Now again, however, you may purchase a meter that does not supply test strips, and you may have to purchase them separately. They did come with my to-go, so I was very happy about that. The other thing you will get is you will get a lancing device. Now, my lancing device is very nice because it comes with several pieces. This clear piece I could use if I wanted to test my blood sugar on my forearm. Then I would use this clear piece. However, I am going to use my finger, so I will put that to the side. My lancing device has a couple of pieces. The nice thing about it is that I could set it to certain depths. So if I have very thin skin, if I'm an older adult, then I would set it from 1 to 2. If my skin was a little bit thicker, I could set it from 2 to 3. Or if I had really thick and callous skin, then I could set it between 4 and 5. Well, I'm a little bit of a baby, so I'm going to set mine at 2, which I already have it set at 2. Then you will twist off the top. This is the arming barrel. And so you would take your lancet, place it inside of your arming barrel, and then twist off the top. Now, my lancet, I felt it already armed itself, so I have to be very careful. So if you have one that might arm, be very careful. This trigger, if I pushed it, would cause the lancet to pop up, and I don't want it to work before I'm ready, so be very careful. So I take the top and screw it back on. being careful not to twist it anymore because I don't want it to pinch me too deeply. So I'm going to set that down gently because it has already armed itself. Now, what you want to do is turn your meter on. My meter is nice and easy because if I put the strip inside, it will already turn on. So what I will do first is to wash my hands. If you're checking your blood sugar at home, you could just use plain soap and water. I'm using hand gel. So I'm going to rub that in very well, making sure that it dries before I get ready to test my blood sugar. So having done that, we are now ready to check our blood sugar. So with my True2Go, the moment that I place my test strip inside, the meter comes on. However, I can also use the power button at the bottom. But I am just going to gently insert, and you see it comes on. Can you see that? There's a little bit of a glare there, so it's difficult for you to see it. There we go. So now you see the little blood drop. We better use it before our 2 minutes are up. So you want to prick your finger at the sides. It's more painful if you prick it at the top. Again, remembering that I'm quite the little baby, I'm going to press it. Ouch. And you see you get a drop of blood. Now, with my meter, you just hold it up next to the drop of blood, not putting it on top, but right on the side, and it sucks the blood in. There we go. And it is starting to read. Now, you're supposed to have a cotton ball so that you can stop the bleeding. Now, if you look here, you see that my blood sugar result is 101. Okay, and I have a little thing here to stop the bleeding for my finger. Which was nice, it came with my meter. So 101 is my result. Now, again, with my meter, as soon as I take out the lancet, it goes off. And I have here, let's put that down, I have a hazard box. Now, you could either purchase a hazard box or you can use any strong plastic that you have around the house. So I'll place my test strip there. And then I didn't throw away the little top from my lancet. I kept that for a reason. So we put that down gently, and then we screw out the top of our arming device, our lancing device, and then the very needle tip we push down into that top, so that when you pull this out, you don't stick yourself again. And then you dispose of it, twist your top back on your lancing device, place that down, and then you would take your book that's provided for you for recording your blood sugars. So, that in a nutshell is self-testing with a True2Go meter. Well, I hope this was helpful, and I hope you learned something about diabetes and testing your blood sugar with a True2Go meter. Thank you, and have a great day. Remember, If there's any questions you have about your diabetes, remember to consult your physician. This is in no way meant to be advice for your diabetes or for the True2Go. This is just an educational video helping you to understand how to take your blood sugar with a True2Go meter. Bye-bye.